what is functional medicine?
Well, it's a branch of medicine that deals with the underlying cause or causes of illness. So rather than just treating the symptoms, basically you're going to find what's actually causing those symptoms. And then when you address the actual causes, the symptoms should go away. Yeah. And the good thing about it is that clients don't have to be on maintenance medications, because maintenance medications are like band-aids. They just treat the symptoms without treating the underlying causes. And that's why most people who are on medications, eventually they get side effects. And when they get side effects, these side effects get treated with more medications.
Yeah. And so they don't really get to the real cause, which causes more problems that they had before.
Yeah, exactly. It becomes a vicious cycle once you start on a medication. That's why a lot of seniors end up taking a lot of these medications.
They have a bottle of pills. Which they're afraid to wean off eventually, because they say it's going to be for life.
Yeah, because that's what doctors tell them. Well, which is right, because if you don't treat the underlying symptoms, you just have to take the medications long term.
Doc, how is it different from, because there are a lot of terminologies, homeopathy, integrative. How is it different, or is it the same?
Well, actually, integrative medicine is just a combination of conventional medicine and all alternative modalities. And under integrative medicine, you see functional medicine, homeopathy, acupuncture, Ayurveda, and all that.
I see. So it's a mix of both worlds?
Yeah, I was trained in internal medicine in Chicago. So my training was in conventional medicine. But during my residency, I just got disillusioned, because we were just treating patients' symptoms. They keep on coming back with the same symptoms. They may feel better for a bit, but eventually the symptoms return. Conventional medicine is always the same approach. Oftentimes doctors, because we're always in a hurry, especially if you work in like the hospital, you're always in a hurry to like let the patient go, so you write a prescription. So I don't blame my colleagues, but most of the doctors are basically getting their continuing education from drug reps.
Exactly.
Exactly.
Which funds.
It funds basically your continuing education, even medical school.
And the whole system is actually funded by the
big pharma, exactly.
What kind of patients do you see, Doc, in this clinic? Or in your practice?
In my practice? Well, I started out with internal medicine, so mostly people in their 50s or so. But eventually, I got to see younger clients because, especially in the holistic medical field, if you are able to treat one person, then they would refer their families. So eventually, some of my clients referred like autistic kids to me. And so my youngest client, I guess, was like 2 years old. So he wasn't communicating. And he just did things on his own. But after I did some investigational studies, I found out that he had elevated mercury from his system. And so we started out with just putting him on a GFCF diet, which is a gluten and casein-free diet, and also detoxed him homeopathically. So after a month, he was able to start speaking. So very simple changes in diet could sometimes bring drastic changes. Because sometimes in autism, it could also be a gut dysfunction. This happens to babies who are put on a lot of antibiotics. So eventually they have problems with their gut.
And definitely. Now that you mentioned the gut, what are your thoughts about antibiotics?
With antibiotics, there are natural ones that don't affect your good flora. So these are like cinnamon, oregano, colloidal silver. The prescription antibiotics are broad spectrum, so they kill even the good bacteria. It's necessary to replace those good bacteria after a course of antibiotics, but it's not being done in conventional medicine.
And it seems like every time you go to the doctor, there's always one prescription. It's always the antibiotics. So it seems like they're treating everything with antibiotics.
Yeah, even with upper respiratory tract infections, oftentimes it could be just a viral infection, but sometimes patients don't feel satisfied just being told, oh, you need to drink more water or rest or take some vitamin C. So sometimes it could be the patient's fault as well. They expect something from the doctor.
Which will make them feel better.
Yeah.
So if they don't receive any prescription, they feel as if, what did I pay for?
Yeah, exactly. That's right.
Thank you for watching Health Me Jenny. Stay healthy, stay happy.